Welcome, and thank you for logging in to the School of Nursing's briefs on quality improvement. My name is Dr. Renee Franquiz, and I'll be speaking to you today on the topic of measurement. Our aim with this brief is to discuss the role of measurement in a quality improvement initiative and guide students in the development of an effective DNP project measurement plan. It's through a well-designed and well-executed measurement plan that you'll be able to know if your DNP project made a difference. Following this presentation, you'll be able to state the purpose of measurement as it relates to quality improvement, identify appropriate measures for quality improvement initiatives, explore measurement methods using a case study scenario, and track measurement data for decision-making purposes. We understand measurement as a process of quantifying something of interest. One might measure the width of a window, or the volume of sound, or the brainwave activity of a patient. The act of measuring provides us with data, and if it's valid, it provides us with the information that we need to draw accurate conclusions and make decisions. Without valid measurement, our conclusions and decision-making are subject to flaws. Understanding why we measure, let's discuss when to measure. Measurement occurs in two major phases during a QI initiative. First, during the context phase of a project, when assessment is conducted to better understand what is happening in the organization during the delivery of healthcare. Metrics such as infection rates, turnover, or length of stay are all examples of an organization's context data. While we know that your hospital infections rate is 10% might be of interest, the data alone fails to tell us why infections are occurring. To understand causes, we use an evidence-based approach called fishbone diagramming to conduct a root cause analysis of the data and the problem. Two organizations could have the same exact infection rates, but the cause of the problem at each site could be quite different, necessitating different interventions. The second measurement phase occurs during project implementation. This requires baseline measurement at the start of implementation and ongoing measurement of every eligible instance, with data tracking on a weekly basis to determine and respond to data trends. Weekly data trending will allow you as a DNP student to monitor your improvement project and to track your progress towards goal achievement. Now let's turn our attention to project goals as a critical step in the development of a measurement plan. Before developing any goals to improve quality and outcomes, we must first accurately identify the cause of the practice problem. I would refer you to a previous brief on fishbone diagramming to review the concept of root cause analysis. For our purposes here, let's assume that the root cause of the high infection rate that I previously mentioned is variability in aseptic technique. Conducting an evidence search will lead you to evidence-based solutions to address this root cause, which will then serve as both your basis of your project and the development of your project goals. Recall that goals are categorized as short, mid, or long-term based on the amount of time expected for goal achievement. In addition to time frame, goals reflect achievement of different types of measures. Let's take a closer look at each of these types of measures. Structure measures reflect the characteristics of an organization where the healthcare occurs. Structures include fixed conditions, such as resources, supplies, equipment, people, as well as time and money. When you think of structures, think of resources. Process measures reflect the desired behaviors performed by the participants in the project. Using our infection control example, behaviors of properly donning and doffing PPE would be process measures. Lastly, outcome measures reflect the effect that the structures and processes are expected to have on patient outcomes and quality of care, such as our actual infection rates. As you conceptualize your DNP project, imagine this simple equation. Evidence-based changes to structures plus evidence-based changes to processes are expected to equal improved outcomes. All DNP projects are required to change at least one structure and one process measure. Depending upon the planned practice change, some projects will achieve structure, process, and outcome, whereas others may only be able to achieve structure and process changes because additional time is needed to realize a change in the patient outcome. Let's use this case study to develop a project measurement plan for an organization experiencing a practice problem. Delta Hospital is a 1,000 plus bed urban academic medical center, which has identified an increasing trend in the number of children who present to the pediatric ED with injuries to indicate possible intentional maltreatment. Notice that the problem is correctly stated in terms of patient outcomes and not in provider practice. A team at Delta Hospital conducted a root cause analysis of the setting using a fishbone diagram to determine all of the possible causes of the problem. They noted a gap in their assessment practices to identify, refer, and manage children at risk for injury due to maltreatment. In order to improve the quality of care and patient outcomes, a team was mobilized at Delta Hospital to conduct an evidence review and initiate solutions to accurately and precisely screen, refer, and manage children for intentional maltreatment. As we mentioned, goal statements are essential to your measurement plan. So let's take a closer look at the likely goals developed by the team at Delta Hospital. An example of a structure goal would be designated as short-term was the selection of a reliable and valid maltreatment screening tool. A date for goal achievement must be added. Because structures are most often dichotomous, meaning they are either achieved or not achieved, a benchmark is not warranted. An example of a process goal designated as short and mid-term goal was 100% adherence by the pediatric ED healthcare providers to an intentional maltreatment protocol. The team at Delta Hospital will need to provide us with further details regarding the specifics of the protocol that was based on their evidence retrieved. Lastly, the outcome of interest at Delta Hospital designated as a long-term goal was the prevention of injury. Note that this reflects the impact of the practice change on the patient. While outcome measures are considered the gold standard for evaluating quality, outcomes are not always feasible to measure during DMP projects due to the limited implementation period during an academic term. A measurements matrix, such as the one reflected on this slide, can serve to help DMP students illustrate all of their desired project measures and a time frame for achievement. DMP projects are expected to use national endorsed measures whenever available, such as those from the National Quality Forum. If none exist, students are advised to utilize professional publications for guidance. Using the case study as an example, identifying a valid screening tool and conducting training are two short-term structure measures, while integrating the screening tool into the EHR is a feasible long-term measure given the lengthy time and effort needed to make changes to an organization's electronic health record. Short-term and long-term process measures of interest are screening, referral, and management of eligible children for the practice change. Note that as a process measure, this correctly reflects the behavior of the project participants. The outcome measure of preventable injury is designated as a long-term goal, given the judgment by the team that it might require an extended length of time to achieve. Note that the outcome goal reflects the impact of the project on the patient and not the actions of the provider. A balancing measure is considered if changes designed to improve one part of a system might actually cause a new problem for the system. For example, if we wanted to screen for positive cases of intentional maltreatment, such as Delta Hospital, we'll also want to make sure that we're not generating false positive screens. A balance measure would require tracking for this occurrence and correction if identified. A well-constructed measurement plan requires very careful forethought. Think about what you're measuring. Refer back to your goals. In our case study, Delta Hospital's process measures of interest was adherence to a protocol. The team will use a validated screening tool to measure maltreatment and track the screening and referral behaviors of the providers. This data generated from measurement may be recorded in the health record as part of the routine delivery of patient care. Data can then be collected later for analysis by a manual chart review. As a final measurement consideration, it's important to plan who will conduct the measurement and how the generated data will be recorded and retrieved to protect the privacy and confidentiality of the project participants. Now, as you think about your DMP project, reflect on each of these questions as they relate to each of your project goals. When considering the data that you'll need, revisit your goal statements. Delta Hospital's goal was for 100% of eligible children to be screened for intentional maltreatment and referred for evaluation. This requires that the team have data regarding the screening and referral behaviors of the provider in their emergency department. It's highly valuable to have measurement data regarding the behavior of interest at baseline to serve as a comparison as you track your project weekly for data trends. Your data trends can be presented as an absolute value, such as 65 children were screened and referred for treatment during the first week of the project. Or data can be presented as a relative value. A relative value expresses the data as a ratio, such as 65 out of 100 eligible children were screened and referred for treatment. 65 represents the number of eligible children who were actually screened, and 100 represents the total number of children who were eligible for screening. Collecting both numerator and denominator data in this manner on a weekly basis allowed Delta Hospital to calculate a relative value to compare to the benchmark in their goal statement and monitor their trends of achievement or underachievement. Your project must specify the population eligible to be included in the initiative. Ethically, all populations who can benefit from your planned practice change should be included. Consider carefully the inclusion of vulnerable populations and all demographics, making certain not to inadvertently deny any population the benefit of your project. There is much more to interpreting project data than a consideration of relative values as we've just discussed. You can learn more about interpreting project data in one of our other QI briefs on project data analysis. After determining the who, what, and when of data collection, you'll want to turn your attention to your data collection procedures. A primary method of data collection that many DMP students use is auditing, such as manually retrieving clinical or care delivery data from the medical record. Alternatively, a data query performed by an organization's IT department can avoid the intensive labor of manual hand audits and can provide you data in a de-identified fashion to avoid any privacy and confidentiality risks. Another possible procedure is the extraction of data from software loaded on medical devices. An example of this would be downloadable blood glucose levels that are recorded in a continuous glucose monitoring device. It's possible that an organization may not have a feature in the EHR to document your measure of interest. In this instance, visual observations of the practice change or interviews are a measurement option to consider. Carefully think about the need to protect data that's generated through your observations and interviews, since this situation is likely to involve a manual record of the data outside of the protected health record. When conducting your DMP project, remain flexible with any and all of these procedures based on the options available to you at your project site. Valid measurement tools or instruments are an essential component of a trustworthy quality improvement initiative. In our case study, Delta Hospital conducted a literature review and identified this 6-item measure for their initiative known as the ESCAPE instrument. The instrument has reliability and validity associated with it, which strengthens the team's confidence in using this measure for their project. Aim to utilize established, reliable, and valid measures in your DMP project to strengthen the credibility and rigor. Consider measures endorsed by organizations such as the National Quality Forum, which endorses over 300 measures to drive healthcare improvements. Use of student-developed tools and surveys are highly discouraged as they raise serious legitimate questions regarding the validity of the project data and the subsequent conclusions that you may reach. A project team or a DFP student will create a data management spreadsheet, such as the one illustrated on the screen, to track the data associated with the project. Tracking tools are typically simply Excel files designed to record the data that you've retrieved as the result of your measurement procedures. Analysis of this data will help you to determine the effectiveness of the project on a weekly basis. Therefore, your tools should be developed with a measurement and data analysis plan in mind. Delta Hospital tracked the total number of eligible patients for the project and the number of patients screened, as well as the results of the screening and the referral to social work. It's ideal to create categorical data elements for each attribute, such as the ones included in the example on this slide. Assigning numeric codes for each possible response will allow for the efficient application of an Excel function to the data set for future analysis. Notice that Delta Hospital assigned a case code to each participant in the project rather than listing their name or medical record number. This action is essential to the protection of participant privacy and confidentiality. This approach requires the creation of a separate, secure code sheet to identify each code and its meaning. In this example, the medical record number is the meaning of each code, which is needed to conduct a chart audit at a later time to retrieve project data for each of the project participants. I hope that you've learned from this brief that the purpose of measurement is to understand the context and the impact of a quality improvement initiative, and that we must use reliable and valid tools to measure our change. We've also learned that it's essential to develop a measurement plan before beginning any improvement initiative. You'll know if your project made a difference by analyzing what your data is telling you. I wish to thank you for your attention today, and I wish you all the best as you implement your solutions to improve patient outcomes and the quality of care that we all deliver.